Time now, 8:07 in your Health Watch. A parasitic illness is causing prolonged gastrointestinal symptoms across the United States, including here in Arizona. There are at least 10 confirmed cases in our state. It is spread through food and water, most often associated with fresh produce, including berries, basil, leafy greens, and the symptoms, it's not great. Loss of appetite, nausea, vomiting, and hope you're not eating breakfast, explosive diarrhea.
So joining us this morning with more is Dr. Frank Lavecchio, emergency medicine physician with Valleywise Health. It's good to see you, my friend.
Good morning. Good morning.
This is something that is spreading all around the country.
Absolutely.
Yeah.
You know, Michigan has like over 1,500 cases. We only have 10, so we feel fortunate. But the explosive diarrhea, you hit that right on the head. People can't even go out because they're so afraid that they're gonna have diarrhea. So it's pretty serious, but no one has died.
Okay.
The explosive diarrhea is serious.
Now, can they trace where this is coming from? We keep hearing berries, leafy greens, things like that, but have they been able to pinpoint where this is coming from?
I was hoping I could talk to you beforehand because it is from people's feces.
Oh.
So somehow that got contaminated into the water supply. Somehow that got contaminated into what they're watering the plants with and cleaning things with. The best prevention, of course, is to clean your stuff vigorously and, hope that you don't get it.
Gotcha.
Unfortunately, if I ate something with it today, my symptoms don't start for like a week. So that meal is long gone.
Yeah.
And then how long does that last?
Well, untreated could last up to a month, if not more.
When you say untreated, how do we treat that then?
The treatment, of course,
and how do you know it's that serious?
That's right. The treatment, of course, is good hydration, etc., but there is an antimicrobial agent we could take, a common one, Bactrim, and usually 5 to 7 days of it will knock it out. I've started in one of my friends. He could not play golf. He played one hole, and then he'd have to run to the bathroom with explosive diarrhea. And I said, hey, you might have this. And lo and behold, he had it. But we didn't know where he got it from because he travels a lot for work.
Sure.
You know, we assumed Michigan, but most likely it could have been Florida.
Now, you mentioned there's 10 cases here, but a lot of people are saying maybe they're not getting tested, so we really don't know how many cases are potentially here, right?
You're absolutely correct, and I give that number. There's 847 cases that were confirmed, but there was like 1,500 that were being watched. 86 people have been hospitalized. Nobody's died. You know, it doesn't really kill you, but it can make you really, really dehydrated, which is the last thing we need in our weather right now.
How long should you wait before going to the doctor, because then you have to get tested, and then you have the Bactrim, and then that takes another 7 to 10 days. So when should you head to the doctor if you have some of these symptoms?
Listen, if you came to me and you said, I've had explosive diarrhea for 2 to 3 days, I would say, look, I'm going to empirically treat you. And the reason why I say that is the Bactrim for a couple of days has very, very little harm. Most people say if it's a week, that means you more likely than not have it. Explosive diarrhea. You know, explosive diarrhea, abdominal pain, nausea, all of those things.
I hate to ask this next question, I might regret it. What's the difference between explosive diarrhea and normal diarrhea?
Right, that's a great question. Okay, that's a great question. Right now I have explosive diarrhea, I gotta run to the bathroom.
Right now?
Right now. I was like, Celeste, hi, you guys look great, and then I'm running.
Okay. Yeah.
No, you can't pause. There's no waiting. And I'm afraid to go out. I'm afraid to go to the grocery store.
Gotcha.
Because, it might happen on the way.
So you hear a lot about how you should wash your veggies, and some people will put, I know I did this over the weekend, you put baking soda and water and let your berries. Is that a good way to clean them?
That's a great idea, and other people say to brush it. If you want to be totally safe, I'm not saying to give up veggies and fruit, we can't do that. You know, that has a lot of health benefits, and the chance of getting this are so low, but if you cook stuff, you're fine.
Gotcha.
Cook stuff to 160 degrees or so Fahrenheit, it's not going to happen. It dies.
I've always wanted to try deep fried raspberries. This could be the time. This could be the time.
Make a call, Poe.
Right. Go to the State Fair. They might have it.
There you go. Well, Dr. Lavecchio, thank you.
Thank you.
Yeah, thank you for coming in.
All right.
Appreciate it.